regarding the application of organon medicine in clinical practice. Respected dignitaries, my colleagues, and my beloved students of homeopathy. Actually, organon medicine, some may say that it is a theoretical book, but really it is just the opposite. It is the most practical book of clinical practice. And organon medicine, there are basically, arbitrarily, it is divided into two parts, theoretical and practical. Unless and until we know the theoretical part properly, then it is very difficult for us to practice according to the rules and regulations of homeopathy. And there are various key words in every aphorism. Those help us to perceive the aphorism, to understand deeply the aphorism, and apply those in clinical practice. For example, we know the cause and effect relationship. We say effects follow causes in unbroken succession, and we have to know the causes. Actually, we evaluate the effects. There is evaluation of symptoms. But first time in aphorism number 5, Heena has mentioned evaluation of causes. How do we know that? He says most probable exciting cause. How do we know that it is the most probable exciting cause? So there may be minor causes. We have to evaluate, we have to analyze the most probable exciting cause. Sometimes patient may say us that a minor cause may produce, suppose after a just little accident, my knee is suffering, I am suffering from knee pain, there is osteoarthritis. But you know that osteoarthritis is a degenerative process. It is not possible for a patient to suffer from osteoarthritis after a little injury. So, these causes are to be evaluated properly. And in this condition, knowledge of disease is very essential. Our master has mentioned in aphorism number 3, knowledge of disease, indication. In first edition of Organon medicine, he has mentioned knowledge of disease in general and knowledge of disease in particular. And knowledge of disease indication. So what indicates disease? We have to know the common symptoms of the disease and the uncommon peculiar characteristic symptoms of the disease. Sometimes we may ask, there are many unqualified homeopathic physicians, quack homeopathic doctors. How do they know the uncommon symptoms, common symptoms? If we say the common symptoms are diagnostic symptoms, then the quack practitioner who only studies Metier Medica without any knowledge of pathology, practice of medicine, how do they conclude that it is the uncommon symptoms? So, after observing various patients, they come to conclude that probably these are the often imperceptible beings. What is the interpretation of the word often? It is not always. So, chronic disease may start with perceptible beginning. If the cause is very serious, then patient may recollect the condition or the cause from which his disease or her disease has been started. So often the word is very important. So it is not the differentiating point that it is insidious, so it is chronic, it is sudden, so it is acute. Similarly, when we come to analyze the disease into acute and chronic, then the knowledge of miasm comes here. And so there are many physicians, even in institutes, other than organon medicine, they say, miasm, just they laugh at the word, hearing the word miasm. But Heena has mentioned in his book, Chronic Disease, that the word and the interpretation and the perception of the chronic miasm would be really very much difficult for the future. But sometimes it is safe. There is no barrier, there is no obstacle, there is no opposition between the knowledge of mathematics and the knowledge of miasm. Totality of the symptoms and the miasm. Actually, knowledge of miasm help us to know better the totality of symptoms. Sometimes, without any knowledge of miasm, we may prescribe on the basis of totality of the symptoms, on the basis of mathematica. But it may happen that there are some situations where miasmatic knowledge help us to know the predominant state of miasmatic state, and then medicine is prescribed on the basis of background of this condition, miasmatic state, along with the uncommon peculiar characteristic symptoms. In aphorism number 18, Heena has mentioned the totality of the perceptible symptoms and conditions. So what is the meaning of and conditions? Not the or conditions, but and conditions. So conditions are the background on which totality of symptoms is formed. Suppose a patient says, "Sir, I am feeling pain in my great toe when there is coughing." Is it peculiar symptoms? Maybe or may not be. Because there may be a severe trauma in the great toe in the last day, yesterday, and the patient is suffering from cough, severe cough for 2 days. So whenever he coughs, he or she may feel pain in the great toe. That is the common symptom. My teacher, Dr. R. Jwadgar, when he taught us in classes, when he gave example, he said, suppose a patient says that I am feeling better when I take rest, and least movement aggravates my condition. What is the medicine? Brania alba. And he says, probably, both are. We laughed then, but now we understand. Suppose a patient has extensive rib fracture, slight movement aggravates, then is it Brania? May or may not be. So it is the conditions on which totality of the symptoms depends. There are various examples also in various aphorisms. In 256 aphorisms, we know generally aggravation is of 3 types: disease aggravation, medicinal aggravation, and homeopathic aggravation. And amelioration, there is no type, only amelioration. But 256 aphorism says that it is not the real amelioration. Why? Heena has said that in pulmonary thysis with lung abscess, he has said, don't be assured that patient may feel better, but you have to judge, you have to analyze the case in case of pulmonary thysis with lung abscess. Because in this condition, when patient says, I am feeling better, you must consider the totality along with the pathological state. There are various examples. Suppose in case of surgery, peptic perforation, second stage of illusion, there is also amelioration of the symptoms, what the patient says, but the pathology is gradually progressing. So we have to identify these type of situations where amelioration, to say amelioration, is there any real amelioration, or the patient, suppose in tubercular type of tubercular diathesis patients, often they say, I am feeling better. They are sure of the disease. Action of medicine quickly expires in acute diseases, proportionately long lasting in chronic diseases. Same medicine. Suppose lycopodium may be administered in acute bronchopneumonia, it is a very good medicine. Maybe it may require repetition of the dose. But in case of chronic disease, lycopodium single dose may not be required to repeat. So these knowledge will help us in clinical practice. Regarding the repetition of dose in 50 millisiemenal potency, aphorism number 248. Sometimes it is seen some physicians repeat according to daily repetition, 16 doses, 14 doses. But we have to think about the matter in case of aconite, in case of belladonna, and in case of medorinum, carcinosin, lycopodium, argentum niticum. Are they placed in the same table? Because Hahnemann has mentioned may be repeated. May be repeated. It is not must be repeated daily. May be repeated. So according to the situation, we have seen in our practice, sometimes 50 millisiemens potency may be required 14 doses, 16 doses, sometimes 4 doses, sometimes single dose. And repetition according to the situation. Because homeopathy, the main theme is individualization. Not only the individualization of the patient, individualization of the medicine, individualization of the potency, individualization of the repetition, and individualization of the management also. Suppose in case of malnutrition, you may prescribe, you may advise a patient to supplement food like milk, but patient may have aversion to milk, may have intolerance to milk, so substitute food may be administered. Some patients may require high protein diet, it may be vegetable protein, it may be animal protein. So in this every aspect, individualization is the theme around which homeopathy revolves. There are various cases, relationship of remedies in first prescription. Usually relationship of remedies is applicable in second prescription, complementary, antidote, change of plan of treatment, etc. A fatty lady, aged about middle aged, more on face, left side, cough, expectoration yellowish only in the morning, but sudden suffocating dry cough at night, came to our DMD OPD, and what on examination, grapes found at the base of the lung. And patient suffers from this recurrent cough 3 or 4 months interval. Thuja occidentalis 201 dose was prescribed. Why not Bryonia? Why not hypersulfur or other medicines? Patient suffers from recurrent cough and cold, 3 to 4 months interval. The patient is fatty and her cough aggravates dry cough in the middle of night. That is arsenic-like symptoms. Only if these symptoms was present, then we may prescribe arsenic album. Along with, in the morning there is yellowish expectoration. So arsenic and thuja, they are very close relative in case of respiratory tract infection, in case of asthma, in case of COPD. So in the first prescription, thuja was prescribed and patient got relief. No other symptoms was found for observation on 2 to 3 months. Similarly, in case of miasmatic, a patient aged about 14 years, 8 years, came to us mesenteric lymphadenopathy, thin built, appetite less, pain in the extremities, tight pressure, ambulation. Others suffered from Cox disease. Actually, these are the totality, these are the gist, synthetic form of the symptoms. But how do we conclude such synthesis part? That is very important. And patient was, her ultrasonography shows mesenteric lymphadenopathy. They prescribed antibiotics and no relief was there. I prescribed calcarea phosphate. So, mesenteric lymphadenopathy, history of Cox infection, no other symptom, only pain in abdomen. So, this is very important. This time, miasmatic knowledge help us to prescribe. There are various situations where miasmatic knowledge help us to differentiate clearly which or what are the few medicines are to be administered. 50 millisiemens potency to 48, what I have just mentioned. Lazy, pain in knee joints, squatting aggravation, perspiration on forehead, desire sweet, warm food, and chilly patient. This was the case. Skin rash appeared after 4 days, after medication. Pain in knee joints aggravated after 7 days. Old skin rash reappeared, which was treated with allopathic ointment before. Patient is still under treatment, calculate at 0.4 dose only, not 16 dose, not 14 dose. Where there is chance of aggravation is more, you must prescribe less repetition of the dose. Prescription on present complex. This was the case of a student's mother in DND during the lockdown period 2020. She lives in Bagilpur area. Severe burn and I prescribed only over phone consultation because it was not possible to see the patient. This was the last condition. And this prescription was done. There were series of medicine, and you know that this is a very serious condition. It may require hospitalization, but patient is more homeopathic minded than me also. There are series of medicines was given. Maybe such series of medicine may not be required if the patient would come to us, but it was not possible due to lockdown period 2020. There was high rise of temperature once, very high rise of temperature, and I was afraid. Probably there is septicemia, septic shock, so many pathological terms came to my mind, and then pyrogen was given, and it works like an antibiotic. Now the case of alopecia areata, simple case. These were the prescription points, criteria first 200. It was a case of hemangioma. First visit. These were the prescribing points. Initially it was a little bit aggravation there was. Completely gone. There was a PCOS OS case and it's been. This was prescribing points, Algeria card 200, ultrasonography normal. Hemorrhagic cyst of ovary. This was the report. Natron card 3200, 1. Venous leg ulcer. Graphitis. This was the